Years ago, when Plan for Health was created, it was a way for like-minded doctors and practices to provide patients with the care and services that they needed in an affordable way, and also worked in a financially responsible way for the business of the practice. Over the years, that same foundation rings true, even more so now that there are so many more uninsured patients and practices that are no longer choosing to be tied to insurance. When done correctly, membership plans are a way to ensure your patients are scheduling and staying on the recommended recare cycle. It improves overall productivity and revenue while providing the best care possible to your patient. It's also a key element in dramatically reducing dependence on your insurance relationships and your patient attrition. Dental savings plans, loyalty plans, membership plans, no matter what you name it, let's identify what exactly a membership plan is. We know not all programs are created equally, nor can we compare them as apples to apples. The simplest explanation is that a membership program should be a loyalty program that you manage directly. It's structured in a way so that all preventive services are bundled together for an individual patient and provides that patient with a savings or discount off of your regular UCR fees for both the preventive membership plan and for restorative services. Whether the patient is paying a one-time annual fee or you're allowing them to pay monthly, the patient is prepaying for their services and committing to their health for the entire term of the membership. In a general practice, there should be a plan to fit each stage or health of a patient. Typically, we help create a child plan, an adult plan, and a perio membership plan. The pricing, the frequency of the visits, the services that are bundled are customized with the practice, with the intent of raising the standard of care, seeing the patients more often and consistently. TrueBlue's Plan for Health takes a fully comprehensive approach to a membership program. We believe in creating membership plans that fit your practice and treatment philosophy so that it's a win for the practice and for the patient. When used correctly and efficiently, it allows your practice the ability to offer patients a direct way to provide affordable dental care that you are prescribing. For a practice using TrueBlue's Plan for Health membership program, the patient enrollments not only increase your collectible production, but it significantly increases your recare effectiveness rate. Patients are filling your hygiene schedule by pre-scheduling all of their visits for the entire year. You're seeing them more consistently, you're seeing them more often, and you've created a program that makes it affordable for them. So why is it important for a practice to consider a membership program at all? Well, we touched base on it a few minutes ago, but by not being dependent on insurance, the practice is able to put the focus on prevention and higher standard of care for the patient. With the Plan for Health membership program, all annual preventive services are bundled together into a membership plan, allows the practice to fill the schedule. It creates the stickiness and strengthens the relationship with the patients. In turn, the patients are rewarded and see the value in investing in their oral health. Not only are they receiving a savings by purchasing a membership program of the bundled services, but they also have the opportunity to utilize a set discount off of all other services they may need, such as crowns or fillings, even products if the practice chooses to. So this program is available to every patient. Even if they have insurance, we can show the practice ways to supplement with Plan for Health. It's easily customizable to fit any practice. A program's not simply about deciding to offer a discount service or a membership plan and then collecting the money and hoping for the best. It must be set up properly from the start so that the business runs efficiently. We believe a membership program needs to be created to align with the practice's vision and the care that they provide their patients. We also believe in making sure all aspects of the program have been addressed so that the practice is set up for success in implementing and managing the program long-term. When I work with practices to create their Plan for Health membership program, one of the first things I do is really take a personal approach to building it with them. I want to get to know you or the practice, and I ask questions. Tell me about your practice. How long have you been established in your local area? What does the patient population look like? Are you fee for service? Are you contracted with several insurances? What are your plans for dropping or keeping insurances in the near future? What does the team look like? Have they been in the industry a long time? Are they new to dental? I need to know how to communicate with them and know that they're fully behind you in your decision to bring on a membership program. So what's most important to you in a membership program? Is it to fill your schedule, help make services more affordable for your patients, attract new patients, maybe all of the above? Once I have that, we take a deeper look into the practice's UCR fees, confirm that they're in a healthy percentage, and create suggestions for a program that makes sense for the business and the patient care. So what we gather from the conversations and answers to the questions, along with the UCR fee analysis, really helps us build those specific membership plans. We help bundle the annual services you want to include. We price it strategically, all while addressing the priorities you have in a membership program. After the initial framework of the program is set and approved, we work with the source leaders and team members to roll out the new membership program to patients. That includes how to effectively communicate with patients, how to enroll members, how to track the services, the provider, production amounts of each appointment, how to schedule and walk out the patients so that the accounting stays mess-free. When we say a membership program needs to be a total solution, we mean from inception to rollout to managing memberships and renewals. From the way it's built to the ease of enrollment, the TrueBlue Plan for Health membership program includes everything from how to communicate and market your program to your patients, to how to properly set up your practice management software, to identify and mirror those collections, how to track memberships and visits, and identify what providers have done each service on the day that they were actually rendered. By having the merchant services set up properly on the back end within the software, it allows for secure integrated payment processing transactions that are clear and easy to reconcile. As with any software, in order to collect membership money, you need to have the merchant services connected to your Plan for Health software and then linked to your bank account. This is separate from your regular merchant services, as it's only collecting from the online Plan for Health portal for enrollment. It's specifically set up so when you open the virtual terminal or account management of your merchant services, you're able to see each enrollment, and it's extremely easy and clear to reconcile. So no other third-party discount program or online membership software has such a robust or comprehensive approach. There are other companies out there that sell the software component for membership programs, the ability to sell plans and collect the money for those plans. What they don't offer is how to track those collections, how to distribute this money for providers who rendered the service or allocate it for the patient's visits. They're also using a back-end merchant services company with higher costs to collect and deposit those transactions into your bank account. These companies are structured in a way that works really well for them, but not for the practice. So if you currently use one of the third-party membership softwares, take a look at your agreement. Find out exactly how much you're giving away and paying to them per patient, per month, or per enrollment, and even the payment transactions. At TrueBlue Plan for Health, it's important to us that we provide a recipe for success. We want to make certain that every practice and team has the resources and training to efficiently communicate the program and implement it successfully. When we say we're the total solution, we truly mean from the start of building your membership program with you, setting up your software portal to enroll patients, providing a team with a step-by-step guide with strategies and suggestions and templates to communicate the program, to ways you can use your practice management software, ensuring the clean tracking and accounting, and then making sure all your patients are renewing for the new term. Now that we've covered what a membership program is, why a practice should have one, and how it should be built, let's jump into the 3 steps to get a program up and running right away. Setup with Plan for Health typically happens in 3 steps. First, after signing up as a Plan for Health provider, we work with you to create your program plans. Not only will we provide practice-specific suggestions on pricing and marketing collateral, but we'll also help identify what the real opportunity would be in regards to annual production and expected number of hygiene days based on enrollment projections. Although the pricing and details may look a little different from practice to practice, we do our part on the back end and provide our suggestions in what we call a cost analysis proposal. It's in direct relation to your practice. The cost proposal, as you can see an example on the left side of the screen, shows how each annual membership plan can be built using the annual preventive services a practice wants to offer, their own UCR fees, and the frequency of the visits. It also shows the suggested pricing for each membership plan and the savings to the patient. Along with the cost analysis proposal, we also provide hard copy marketing collateral that the practice receives as part of the implementation and setup. So once the program details and pricing are finalized, the practice receives 500 brochure rack cards and 3 tabletop stand signs. And there's also a one-page flyer the practice can use immediately to print some hard copies in the practice or use digitally for email and social media marketing. In step 2, we get right to work in helping the business team and source leaders get set up and trained on the cloud-based software. This includes how to easily enroll patients, how to communicate with patients, how to get the entire team involved to successfully implement the program. The website portal itself provides access to the enrollment and member management features, as well as marketing templates, verbiage, dialogues, strategies, and more to support the team in communicating the program to patients right away. Some of the action items and suggestions we share are to utilize the practice's communication software that you may have, whether you use Digital Resource or Wondrous, RevenueWell, Solution Reach. We encourage the practice to create an email campaign to introduce the program and to the entire patient population. We also often suggest identifying specific patients on the schedule that are coming in who may not have yet accepted or scheduled treatment. This would be a fantastic time for a team member to discuss the benefits of savings that they could receive as an enrolled Plan for Health member. So all of the templates and the suggested action items in the Getting Started guide are located in the portal. We can also support the front desk or business team leads with a live webinar training. So again, the Plan for Health membership portal in the software is the main vehicle that allows the practice to enroll patients quickly and manage the program directly. So from the legally compliant digital enrollment process and patient agreement forms to viewing membership details and marketing support, the practice gets a thorough and complete program experience. Here's an example of what the Plan for Health portal's main page looks like after you would log into your own practice's software portal. The main page is where you go to sign up a member or invite them to enroll by sending a text message or email. It's also a quick snapshot where you can quickly see member information, active subscriptions, total payments collected. And on the left side of the menu, you can find more detailed information on your members, your membership plans, the analytics, and the marketing by selecting those tabs. To get a glimpse into the functionality and how easy it is to enroll a patient, we wanted to show you how quickly you can invite a member or enroll from your front desk and immediately sign a patient up. If you like, you can send a patient an email or text invitation to enroll on their own. But more often than not, we see our practices enrolling the majority of their patients right in the office. So you have a patient in the office, you can fill in the information for them on their behalf or with them if they decide to do so from a device in your practice or their own phone. Simple information tied to an email address is all you need. And then enter in their first and last name, phone number, and date of birth. And what's also great is you have the ability to target the patient in the right way. So if you have a patient that has periodontal disease, you want to identify that and make sure that they're enrolling in the right plan. You can easily toggle that button and it would only show a periodontal plan should you decide to move forward with that. In this instance, these are the 2 plans available based on the birth date that was selected. So you can choose one of these plans to enroll. You can set up their payment information right from the same screen. You're able to set the parameters and retain complete control over the enrollments and management of the program. You can also have the ability to enroll a patient who has a different form of payment by selecting the collect money offline option. So there may be instances where a patient has a check or cash. You allow for third-party payments, and you can do that as well. One of the safeguards we did put in place is to allow the practice the final say on activating a membership. And the reason behind that is because you want to ensure that the patient is signing up and paying for the correct membership if they're enrolling from outside of the office. An example of that might be a perio patient who shouldn't sign up for a plan with a pro fee or be able to select a child membership. So the pending membership status, as shown here, lets the practice know that a patient has signed up for the plan and accepted the agreement. They've done everything on their end, and now the practice must take that final action to activate. All right, here's the pending. Now, once you've verified that the patient and membership plan is correct, your team member simply selects the green activate button, and it moves the patient's status from pending to active. At that time, when the status moves to active is when the credit card on file is also processed for payment. The portal also pushes out invite communications if you've invited them via email or text and welcome emails after the patient has enrolled. And you have the ability to actually customize that verbiage for those emails and text message invites and edit the text right from your portal's marketing area. Under the members tab over on the left-hand side, you can view the members that are enrolled and their status and the last payment. You can see the renewals, the upcoming renewals for the near future. You can check payment status, make sure if there's any billing errors, you can make that aware and take care of those. Sometimes we see billing errors for expired credit cards or declined cards upon enrollment. So you would double check right there. As part of the initial setup, we do help load the practice's customized membership plans. But in the future, if the practice decides to make adjustments, additions, or archive any past plans, it could be done right in that Plan Builder tab. So you always have the ability to make those changes or create new drafts and make them live. Another great feature in the software is the reporting and analytics. From your portal, you can pull data to show your active Plan for Health members, how many patients have purchased specific plans, and how effective the team is at re-enrolling patients into a new term. So we continue to develop more power in our analytics, and as you add more memberships, you'll see more data represented as well. In addition to the physical marketing elements and collateral that was mentioned earlier, the Plan for Health portal also has a great opportunity to create a robust marketing plan. So from the marketing tab, you actually have a landing page site, a widget, getting started guide, and resources to choose from. The landing site page allows you to have a customized Plan for Health web page. You have digital marketing pieces you send out to patients and they click on the Learn More button. This is the website page where they will land. So the site has all your practice information and your specific Plan for Health membership program information there. From the FAQs to your contact info. And then also they have the opportunity to click and enroll, sign up right then and there. And then they just go through that same enrollment process. The widget is actually an additional element that allows you to put a widget on your existing practice webpage. So it's customizable. You can change the verbiage and position it right on your website. Easily change the text. You can save it once you've edited the text to show how you want, save, and then provide that code to whomever manages your website for you. And again, it'll just pop up depending on where you've selected and kind of bounce around or appear on your own website. We also have a getting started guide and resources to provide step-by-step actions and suggestions of how to communicate to patients, how to utilize the templates and resources so that your team can hit the ground running. And the last step to become fully implemented is making sure your practice management software is set up properly. So we offer the specific suggestions on how to utilize your practice management software to, again, identify and track patient visits, the providers who perform the services on the day that they were rendered, and attach the production value to each appointment. So there should never be a time when you have $0 attached to a membership program appointment. No matter what practice management software you currently use, we help provide the specific suggestions for your service code setup and accounting procedures. Sometimes that might look like a fee schedule to use for your patients. Sometimes it involves a simple adjustment in the ledger. Because there are several ways Plan for Health can work for patients, it really all depends on the practice, the patient, and the reason for the membership, and we work with your team to get to the right place. Now let's take a look at actually some real numbers, the real opportunity and opportunity to make massive impact to your bottom line and the health of your patients. Here's a look at a practice with 1,000 patients. The example shows the potential of getting 60% of the patient population onto a Plan for Health membership program. We're going to assume 30% of the patients are perio patients, and we've just kind of divided out the 600 membership plans, then look like 180 of those are perio plans and 420 are adult plans. Of course, you could go through this example on your own and add in a child plan or something like that as well. So if we had 420 adult plans priced at $675 a year, they're going to be coming in 3 times a year for their visits, and each visit would be allocated a production amount, a total of $225. Again, their visits would include all the services that they would need, a pro-fee exam, any annual x-rays they might need, fluoride, oral cancer screening, maybe perio screening, whatever you decide to bundle in there. That results in 1,260 hygiene visits for the year and $283,500 in annual collections just by enrolling those patients, those 420 patients, into an adult membership plan. And the same example for a perio plan, if it's priced at $900 a year, they're coming in 4 times a year. Again, for this example, it's $225 a visit. All of their services are bundled in. That's 720 hygiene visits a year and $162,000 in annual collections. Just adding those up for the 600 membership plans and how this is distributed, $445,500 preventive dollars and just under 2,000 hygiene visits per year, or said differently, 247 hygiene days that are confirmed and paid for. So keep in mind, knowing that every $1 in hygiene yields at least $2 in restorative care, the real total opportunity is even higher. So if you're a fee-for-service practice, or if you're considering becoming a non-participating provider, then every patient has the opportunity to be a Plan for Health member. If you're no longer in an insurance relationship, the patient still pays up front for their membership. You can submit to insurance on their behalf on the day the services are rendered, and then the insurance company will send a reimbursement check. For Delta, the patient receives the check directly. So utilize this example and fill in where you think you might be on a number of membership plans, or have us help. We're happy to do that. It's a great exercise. Let's get started. Contact me directly with any questions or requests for more information. I'm happy to provide any next steps or discuss your practice and the TrueBlue Plan for Health membership program with you.